Hello, you're watching Leaders Speakeasy with me, Luqman.
And me, Rozina Aziz.
Rozina is the co-founder and CEO of Metamorphosa, a former news, media and corporate woman who now mentors, coaches, trains and consults global leaders and entrepreneurs.
Thank you, Luqman. Today we will have a conversation on leading private healthcare in a crisis. First, an introduction of our guest.
Nadiah is no stranger to breaking barriers. Graduating magna cum laude in biochemical sciences at Harvard College, she then went on to pursue her Master of Science in Public Health Nutrition from the London School of Hygiene and Tropical Medicine. Nadiah's meteoric rise saw her become Chief Operating Officer of Sunway Medical Center by 2016, before being appointed the Chief Executive Officer of Thomson Hospital, Kota, Damansara in 2017 at the age of 32. Today, the CEO hat is just one of many that she wears. The 37-year-old is also the Group CEO of TMC Life Sciences, a director of the Institute of Corporate Directors Malaysia, the Vice President of the Harvard Club of Malaysia, and a WEF Young Global Leader. With the world deep in the midst of a once-in-a-lifetime pandemic, how does this trailblazer transform the world of private healthcare during a crisis?
Nadiah, welcome to Leaders Speakeasy with Luqman and Rozina. We look forward to our conversation with you today. How are you?
Good, thank you. Thanks for having me.
Nadiah, let's start with the first segment, Leadership Mantra.
Your passion in public health came early and you pursued a Master's in Science in Public Health, specifically nutrition, from the London School of Hygiene and Tropical Medicine. What would you say was a turning point that sparked this early interest? Was there, a specific event or a particular figure that inspired you to go down this path?
I think I always loved biology. I knew that I wanted to do something in medicine, but I didn't want to become a doctor and I didn't want to go to medical school because I thought it was going to be very boring and a lot of memorization. So when I worked with BCG as an associate consultant for the first 2 years after graduation, I did a lot of healthcare strategy projects. And as everyone in consulting does, they kind of leave and do an MBA or a postgraduate degree after having some work experience. But I thought doing an MBA was a bit boring. And I am just looking around. I knew that I wanted to pursue a career in health. I was passionate about biology, and I think public health was something where you're talking more at policy level. So there is a big difference between individual health and public health. And looking at Malaysia as well, I knew that obesity and non-communicable diseases is going to be an issue for the country. So I pushed for a plan to do a Master's in Public Health and Nutrition, and I found that the London School of Hygiene was very good in reputation in global health, and I wanted to go and study in the UK and done my undergraduate in the US.
You were the only Malaysian named by Forbes as one of the 20 business leaders on its 2021 Asia's Power Business Women list from diverse industries, among them technology, pharmaceutical, healthcare, banking, investment, and a lot of other industries. Share with us, Nadiah, your own perspective on the achievements that put you in the spotlight during this global pandemic.
I have no idea how I got on that Forbes list, but I can imagine that I have had a lot of public communication during the pandemic because I felt that the quality perhaps of the health and science communication could have improved. With public health, it is really important to have the trust of the public, and you cannot do it alone. And I think that what was really emblematic and changed the course of the pandemic is that when all stakeholders come together. So having leading a private hospital during the pandemic obviously is quite challenging. And at Thomson Hospital, I think I made a very clear decision early on that COVID is something that's affecting the community. Patients need those services, and we should be providing those services even though we're not a public hospital, because they are still our patients and we still need to take care of them. And later on, when it proved that we could not have herd immunity and we're moving towards endemicity, this is something that just has to be part of our long-term plans. So we did a lot of things in terms of setting up screening, COVID assessment centers, admitting COVID inpatients, doing COVID rehab,
So COVID services is now part and parcel of what we do at Thomson Hospital, and I was also involved, I think partly through the communication on social media channels, into the Greater Klang Valley Special Task Force on COVID-19 that was set up sometime in July of this year when the healthcare system in the Klang Valley was overwhelmed. And I was part of the compliance and monitoring team that was assisting the task force commanders to actually monitor the implementation of all the measures that were being taken on the ground. And it was a very enriching experience for me to work with many stakeholders, including the Ministry of Health, the military, as well as the academics from the teaching hospitals. And I think we are very proud of what we were able to accomplish in a very short period of time.
So Nadiah, I'd like to go back. I think you're being a bit humble here about, being recognized by Forbes. So if I want to go back to that and focus a bit more on you as a leader. So when we look at the Forbes list, the women in the spotlight have faced multiple challenges. The pandemic, technology disruptions, changes in how consumers use apps, use digital, business challenges, and much more. So, and you're in private healthcare, you need to also look at stakeholder value, and not just public health. So it's balancing the two. Now, I would say that this requires resilience and the ability to pivot from business as usual. So broadly, when it comes to your leadership, what has been your guiding leadership mantra and your core leadership strengths that have contributed to your success?
Well, I think there are a few things. Firstly, when there's a lot of uncertainty, you don't have much data or past experience to go on. So I think what's important to guide your decisions is actually based on your values and what the purpose of your organization stands for. So take Thomson Hospital, for example, what I was quoting before about providing COVID services, because we knew that we're a healthcare provider, right? So we're your healthcare provider regardless of whether, you have COVID or not, because I think early on there was this arrangement where COVID patients were referred to public hospitals, and the private hospitals were less equipped, frankly, in the beginning to care for COVID patients. But just looking at how the pandemic was moving in other countries globally, we made a decision very early on to prepare, to be able to manage all sorts of COVID patients from screening right down to rehabilitation, because we knew that this is something that would be needed from the community. So that decision was made because, that is our core value as an organization, as a healthcare provider. Even recently during the floods, it was a very spur of the moment decision for me to actually open up our unused wards to give shelter to people who were affected by the recent floods in Selangor. So sometimes you're just making decisions based on value. There's no handbook or playbook per se. But I think it's important in a crisis when there's an uncertainty to have your values to guide you. Secondly, of course, speed and simplicity is very important. So obviously in a crisis, things aren't going to be 100%, but I think it's more important to be out there and do it first and then tweak it along the way, because if we wait, I think that the crisis will kind of blow up even more. So, for example, the drive-through COVID test that we were setting up at Thomson Hospital last year was something that the team put together in only 2 weeks, and they did it just by looking at South Korea and saying, why can't we do that here? And we just piloted. We started it with Excel spreadsheets, and now we have an app that manages the back end for us. So we've obviously come a long way since those early days. So I think that's also very important, that the team is empowered, that they recognize that they can try new things, but we just need to be able to pivot and make course corrections if things are not working well. And finally, I think what's very important for that is communication. So when it comes to communication, it's important to talk not just about the facts, as we can see when we talk about public health communication, but even talking to people within your organization. It's not just about facts, but it's also talking about their emotions. What are the fears that they're facing about this situation? So during COVID, we had a lot of town halls, for example, to address the fears of staff who were worried about themselves and their family in caring for COVID patients. And we also talk about emotions. That is to say that the employees should feel that the organization is there with them, supporting them in going through these hardships or challenges, and employees can relate better to people when they feel that you're on the same side as them.
So Nadiah, we're going to get a bit more into that in the next segment, because we want to understand, your specific challenges and your strategies and the foresight to lead private healthcare and to pivot in times of crisis. Luqman?
Nadiah, with the pandemic dealing a severe blow to public health and the healthcare industry, medical tourism being affected and the lockdowns wreaking havoc on business in general, for the financial year ended 30th June 2021, TMC Life Sciences Berhad managed to record a 6% rise in group revenue to 201 million ringgit. What were the most important decisions you made to take on the business challenges you faced? And how were you able to execute your plans given the uncertainties and the need for speed of change?
Well, I think most important is you need to have a separate and flat hierarchy. With COVID, we actually set up a task force that bypassed all the usual decision-making platforms, because we knew that making speedy decisions was important and people would be making decisions to take everything as a whole. So, for example, for medical tourism, we knew that it would be a big impact on us and also our fertility business, because we used to have about 30% of our revenue coming from international patients. And once the borders closed, that all went away. And so we had to pivot very quickly into offering services that the local population would require. And clearly COVID was one of those things. So I think during the peak of the COVID period, most of our revenue were coming from treating acute COVID patients who had nowhere to go and they had no choice. And we had very high occupancy during that time for COVID patients. And now that wave has sort of subsided, we're looking at other services as well and preparing for the medical tourism to come back again when the borders eventually reopen. So it's very important, I think, that you have a flat hierarchy, you have feedback from your patients, your staff, the consultants, so that you can make the right decisions and empower them to execute with speed and simplicity, is what I mentioned.
So Nadiah, you were quick to pivot by getting involved in the Greater Klang Valley Special Task Force. I think I read somewhere you created 2,000 COVID-19 beds and conducted 26,000 COVID-19 screenings, treated 400 COVID-19 patients, 80 to 90 of that in ICU, and you introduced an online telehealth platform for consultations and pharmacy delivery. So how do you continue to push innovation across your team? I think you talked about a flat team, but at the same time, you need to ensure that their needs and their well-being, their mental resilience are all addressed in these difficult times.
So I kind of see my job as to see what's happening out there in the world, figure out what the problem is that we're trying to solve, and then marshal whatever resources that we have to try and solve that problem. And the ideas can come at any part of this chain, right? It can come from the external inspiration, what's happening out there. It can come from redefining the problem that we're trying to solve, or it can come from thinking out of the box in terms of utilizing what resources we have. And so, we have these conversations all the time where I just tell them, what do you think if we did this? For example, when we, did the COVID vaccination center, what had happened was that the district health office actually reached out to us and said, we need to vaccinate teenagers as soon as possible because this wave is going to come for the unvaccinated. And they actually gave us 3 days to set it up. And I told my team, okay, we'll push back and say we'll do it in a week. In a week, we set up this PPV center together with the district health office, and we vaccinated, a majority of the teenagers within our area. And really, I think it's just about setting the targets for them, telling them that it's okay if things don't work out in the beginning, that you don't expect it to be perfect. Be very careful not to assign blame to anyone, because it needs to be clear that everybody is in this together. And any sort of finding of faults is really with the intention of improvement. And I think that culture is very much baked into healthcare, because if people don't report incidences, it can be very deadly. So this no blame culture is actually really important and healthy for innovation, I feel.
Right. We'll go for a short break. Leader Speakeasy will be back with Nadiah Wan, the Group CEO of TMC Life Sciences and CEO of Thomson Hospital, Kota Damansara. Don't go anywhere.
Adakah penyelesaian rangkaian awan dapat meningkatkan hasil penjagaan anda? Dengan Maxis Right Cloud, pasti ada rangkaian awan sesuai untuk digunakan dengan setiap aplikasi. Akses semua pembekal rangkaian awan. Kawal sistem rangkaian awan sepenuhnya. Lakukan integrasi sistem IT di premis dengan mana-mana rangkaian awan. Jadi, jangan pilih rangkaian awan sembarangan. Pilih Maxis Right Cloud untuk membantu meningkatkan hasil.
Amanah di tangan kita. Adat, budaya dan semangat menjadi kesinambungan perpaduan tanah air yang tercinta. Berteraskan adab yang terpahat di jiwa dan raga. Marilah bersama kita membina negara Malaysia.
Semua yang terjadi adalah berita, tetapi tiada siapa yang boleh bawakan yang terkini dan tergempar seperti kami.
Dilihat hanya memberi wang tanpa matlamat yang tepat. Dia tidak melakukan apa-apa kesalahan.
Untuk mendapatkan jawapan yang bermakna, kita perlu soalan yang tepat.
Amat sedih dengan apa yang berlaku ke atas.
Tiada ruang untuk berita palsu.
Negara kita telah merekodkan kes harian baru sebanyak
hanya fakta yang diberikan.
Amat penting untuk meneruskan perjuangan negara melawan pandemik ini.
Sentiasa memastikan suara anda, suara rakyat didengari.
Kenapa?
Membawakan apa yang penting di mana sahaja.
You're back with Leader Speakeasy with Luqman and Rozina in conversation with Nadiah, the Group CEO of TMC Life Sciences and CEO of Thomson Hospital, Kota Damansara.
So Nadiah, experience provides leaders with 2020 vision on how crisis and pandemics can best be handled. What are the gaps that leaders need to address for future crisis and pandemic preparedness, and how might they go about plugging those gaps?
So having been involved in some way in managing the crisis, both in what I do at Thomson Hospital and also part of the Greater Klang Valley Task Force, I think the key issues are basically coordination and accountability. And what I like to say is that the size of the problem that we're trying to solve should determine the kind of how big the circle of stakeholders that we need to engage. And the COVID-19 crisis and also the floods are a really big crisis. So you do need to get everybody on board, because it's not a simple problem to solve. You know, for COVID, we're not just looking at the health aspects, we're also looking at the social aspects. What do we do with children who have lost their parents to COVID, for example? So we need to do better in terms of like engaging more stakeholders and bringing them to the table, particularly when trying to resolve a problem. The second part is accountability. Now, if you have a lot of people who are coming together, there still needs to be a very clear chain of command, and somebody needs to be accountable, because otherwise people will be afraid to make decisions and decision making will be slowed down. So we also have to be more forgiving and recognize that not all those decisions in hindsight will be perfect. But I think what's important is that those decisions were made in good faith based on whatever data was available, and the decision makers are willing to pivot or make improvements, as soon as they realize that things are heading down the wrong direction, and not bring their ego into it and make it about them in terms of their own personal failures, because we're all here just to try and solve the problem.
Right. Healthcare and mental healthcare capacity, equitable vaccine access and insurance coverage are some gaps that have been identified in the wake of the global and domestic crisis. So how can Malaysia address these gaps in an efficient, holistic manner, and how do leaders like you upscale in these areas in a concerted way?
Wow, those problems are really, really big problems. But I think, surprisingly enough, I think the first step is always to recognize that we do have a problem, and just be really honest with ourselves. Because I think by trying to avoid acknowledging these failures, because you think that it reflects personally on you, can be quite disastrous. Because if you don't think that there's a problem, then people won't be moved towards a solution. The other issues I think are mostly for us in Malaysia, like financial, talent, and also in terms of capacity or legislation. And it definitely needs a concerted effort and will for all stakeholders to actually change that. And a lot of the work is actually unglamorous. It happens behind the scenes, right? When you're trying to hammer out an improvement to a legislation, or you're trying to get different agencies to come together to come up with a policy about what to do about a particular problem that has now arisen based or following the crisis that we faced. So, and the last part, of course, is setting the KPIs and the accountability. We should be more concerned about the outcomes and not really the process. And what I'm concerned about is looking at the bureaucratic process becoming a stumbling block to us solving the problem rather than facilitating towards having a solution that is holistic or a multi-stakeholder approach.
So Nadiah, we're going into 2022 now with the Omicron variant and also the impact of severe weather changes we are witnessing. There is likely to be stress on the healthcare system, public or private. What is the outlook for the industry, and what are your key priorities over the next year or two?
Well, obviously, healthcare has now come very much into focus, not just in terms of healthcare service provision, but also the healthcare supply chain in terms of manufacturing consumables, vaccines, and things like that, and also public health investment. We know that this crisis came about. It will not be the last crisis that we see in our lifetime. So I think all of us within the healthcare value chain will be looking at how we can build resilience into the system so that we can withstand future crises that may happen. So that's number one in terms of like looking at our own capacity, looking at healthcare financing, looking at what we can do to make sure that we have that buffer in place. So that we can act when the time comes. And second is also looking at structure and governance of our systems. Again, how do we have speed and simplicity in our response? And the third thing is also looking at globalization versus localization. So I think never before in the history of the world where we had a sudden stop to globalization, globalized supply chains, globalized labor markets. And so what would that effect be for a healthcare provider? So we're seeing, more and more staff probably leaving to work in hospitals in other countries where their own healthcare workers have resigned due to burnout. We have seen disruptions in the healthcare supply chain. So no doubt many countries are looking at how they can build up domestic capacity so they're not at the mercy of, global conglomerates and things like that. So all of these things, I think, are something that we are looking at. And last but not least is, of course, technology. This was a great experiment in work from home and really putting technology as an important backbone to how we deliver our services with telehealth, teleconsultations, remote monitoring. All of these things are definitely something that we foresee in the future.
So Nadiah, we will now move on to the fun quick fire questions. You only have 20 seconds to answer each question.
Right, Nadiah, this is the chance for our viewers to know you up close and personal.
So Nadiah, what is the one thing that nobody knows about you?
Nobody knows. I'm pretty much an open book, but I really like to build Lego. Our house is filled with Lego sets, and the most recent one that I bought was the Titanic one, which I will need to find time to actually build.
That sounds fun.
Right. Nadiah, since young, you have volunteered for many causes both abroad and at home. You've went to places like Africa to help out there quite a number of years back. So in your personal capacity, how are you lending a helping hand to the flood victims now across the country and especially in the Klang Valley?
Well, obviously, I think like Thomson Hospital itself has been collecting donations, and we have had a lot of employees, unfortunately, who have been affected by these floods, and we will try and sort of assist them financially and with also other things. I was just texting my team right before this to say why don't we organize a gotong royong to help them clean their houses, and also some of them may need specialist cleaning services as well, because it's not easy to actually clean up after a flood. So yeah, a lot of sudden ideas that gets put into practice pretty quickly.
As an avid cyclist, what is your personal best in terms of distance and time, and what's your favorite route?
I wouldn't say I'm avid. I only cycle like once a week because my husband bought me a bicycle for my birthday.
The word is keen amateur.
But basically, I do a route around Mont Kiara. It's about 13 to 15 kilometers depending, and average speed is typically about 21 to 22.
Not bad. Okay, other than work, what keeps you up at night?
My kid, because she goes to bed really late, and I like to read. So I read like a lot of variety of things. So sometimes middle of the night is when you have the time to read. Yeah.
So Nadiah, they say it is lonely at the top. Do you agree with that statement, and why?
Yes, totally. At Harvard, they had this T-shirt where it had the Harvard crest and then all the other Ivy League schools at the bottom, and it says it's lonely at the top. I still kept that T-shirt. I think it's mostly about accountability because at the end of the day, if things go well, it's because of your team. But if things go wrong, somebody has to step up and say, like, you know, I see what went wrong, and this is how we're going to make sure it doesn't happen again.
All right, Nadiah, we have enjoyed hosting you.
Thank you to Nadiah Wan, Group CEO of TMC Life Sciences and CEO of Thomson Hospital Kota Damansara, for sharing her experience and strategies in leading private healthcare in times of crisis. Nadiah is also the only Malaysian on Forbes 2021 Asian Power Businesswomen list.
Be sure to join us on Leader Speakeasy with Luqman and Rozina for conversations on leadership as the country and the world strive to bounce back after the pandemic. I'm Luqman Haris, sending all the love also to all the flood victims across Malaysia. We hope the situation will be better and get better for you very, very soon.
And I'm Rozina Aziz, wishing you the very best in your career, business and leadership journey. Stay safe, stay resilient.